Right now, we're going to start to focus a little more on some of our local tribal community efforts. And so I'd like to go ahead and introduce our next speaker. We have Miss Jessica Rudolfo, and she's going to share about some of the the things that she's had to deal with in her position as Executive Director of the Division of Health and Programs for the White Mountain Apache Tribe. So I will turn it over to you, Jessica. Thank you so much for joining us today.
Hi, my name is Jessica Rodolfo. I am the Executive Director for the Division of Health Programs. I also apologize for all the back feed. I am coming to you from our Emergency Operations Center. I am a part of the Emergency Operations Incident Team here for the White Mountain Apache Tribe. So just to go over some of the things that we've done since the inception and our response to this COVID-19 pandemic. In December and January, we began watching the pandemic. In February and March, the Division of Health Programs started with weekly meetings to continue to monitor and watch how the COVID virus advanced through the world. We established our Tribal Incident Command on March 12, 2020. Early on, the White Mountain Apache Tribe established a unified incident command with our local White River Service Unit that occurred on April 8 of 2020. June was a month where we saw our highest numbers regarding COVID cases. Our Tribal Emergency Operations Center, in response to those high numbers, initiated a 2-week lockdown and back-to-back 57-hour weekend lockdowns. And resulting from these lockdowns, what we saw was a decline in our numbers. We have not seen those high numbers since that time. Our Emergency Operations Center operated daily through July and August. So that included for us even included weekends for us. When we established our Tribal Incident Command on March 12, our CXR director was appointed to the EOC Operations Chief and the EOC infrastructure. This improved our service response immensely to our community. We were able to then establish an alternate care site, an isolation and quarantine site. We didn't understand initially what this would entail. We were very fortunate that one of our departments, our local Rainbow Treatment Center, who provides substance abuse care to the community regularly, had undertaken this task. One of our strongest connections to this response was our response with our White Mountain Apache Tribal Council. They were able to meet with us and pass many of the policies that affected our tribe. We had established a mask mandate throughout the entire tribe that masks must be worn everywhere, as well as implementing policies that created staggered work schedules for our workforce. We created policies that supported our essential service departments. We limited our cultural events throughout the community, as well as limiting all events that had more than 10 participants. We stopped all the selling and the sale sites that occurred on our reservation. And a lot of the things that we did throughout our community. And as you can tell right now, I am coming to you from, as I said, our emergency operation. We have our planning chief, we have our incident commander, we have our finance specialists, our PIOs, as well as our operations chief, our policy unit, and our logistics department and our safety department. I myself am currently assisting the EOC in the liaison status, as well as being a director, the executive director for the Division of Health Programs. So a lot of what we do on a daily basis is we've spent the past 8 months in this room with each other, and up until July, we didn't have any weekends at all. So, and as you probably were able to see, that there were boxes in the background. This serves as a storage unit. We don't have a lot of availability in our rooms and where we might operate. So what we ended up doing was borrowing this room from our local fire department. So in conclusion, when we look at how we did what we did here for the White Mountain Apache tribe, it was because we had so many departments step up to the plate. These departments stepped up with an attitude to serve. They came to the table. They wanted to participate and they wanted to be a part of the solution for this pandemic. We've encountered so many adverse events during this pandemic. We've run out of water. We during the lockdown, we've had people, the streets were completely empty. One of our strongest responses to the pandemic was our contact tracing and surveillance team. What they were able to do was go out to our community members and identify those high-risk patients and identify high-risk community members. We've come upon situations where we have encountered people in the community who had very, very low oxygen levels, and had our CHRs not gone out there, we would maybe have had a higher rate of loss within our community. But in this event, in this response to the pandemic, one of our biggest saves was through our CHR departments. And I know that the funding is regularly, yearly is cut, is on the chopping block to be cut for the services. And annually we have seen a decline in services. And right now there is a lot of push for being able to reimburse for the services that the CHRs provide. Well, in this event and in this pandemic, the reason why we have been able to save a lot of the lives of our community members is because of our incredible CHR team. I just want to say thank you for inviting me to be a speaker at this town hall, and I want to let you know that I appreciate the work that is being done throughout the community. I also appreciate the what everyone else is doing and the interest in our work. But I do want to mention here at the end that, like I had said, a lot of people ask us what our secret is for the success that our tribe has faced. And when I really look back and I think about it, it's that everyone stepped up. Everyone wanted to serve. They were here. It made it easy. It made it easy that our tribal council was here. It made it easy that our IHS service unit were here, and all the departments came out. And the people that I showed you here in this room, they are representative of departments. We're not in our positions that we were in before we came into this room. We came from housing, we came from the treatment center, we came from our client business our business office, we came from CHRs, we came from our treatment centers, and a lot of our departments that are here in this room right now. This isn't our regular job, but this is the job that we do all day. And as you can probably hear by all the commotion that's coming in, that it never ends. It doesn't stop. And we are very service oriented, and we want to be here. We came here to serve, and I myself am a veteran of the United States Army. I served my country, and now I'm in the capacity to serve my people, and I do the best that I can with what I have every single day. So thank you so much.
Thank you. Thank you so much, Jessica. First of all, I want to thank you for your service to the United States. My dad and five of his brothers all served in the military. And so I believe that that spirit of running toward a challenge like a pandemic probably comes from your experience serving in the military.
Yes,
Yeah.
ma'am.
It's amazing. I got goosebumps. But I want to thank you so much for your dedication and the work that you're doing. We will let you get back to work. You're there at the command center, and so thanks for sharing what you have done to combat the pandemic for on behalf of your tribe. And we look forward to getting through this and coming back and being able to hear how everybody's doing and hoping everything is moving forward. So thanks again and enjoy the rest of your day. And please stay healthy and stay safe. Thank you, Jessica.
Thank you.